In this video, we'll learn about infantile hypertrophic pyloric stenosis. Here, there will be hypertrophy of the musculature of pyloric antrum, right? So that's why infantile hypertrophic pyloric stenosis. So hypertrophy of the pyloric antrum. So it is seen in infants or newborns who are exposed to azithromycin or erythromycin in less than 14 days of birth. So what will be the complaints? There will be vomiting, which is forcible, projectile, and non-bilious. And you can see this lump, which is olive-like mass. So it is specific for this infantile hypertrophic pyloric stenosis that there will be olive-like mass, so which is mobile, smooth, and moves with the respiration. So you can see this visible gastric peristalsis also, and there will be constipation, dehydration, electrolyte imbalances. So you can see constipation, vomiting, and the lump will be like olive-like mass which moves with the respiration, so mobile, smooth mass. So you can also see visible gastric peristalsis. And the diagnosis, again, you can palpate the mass and see the visible peristalsis, and on ultrasound you can see donut appearance, and on the barium mill you can see obstruction, right? So treatment, first we have to correct this dehydration and electrolyte imbalances, or else you can do laparoscopic or endoscopic pyloromyotomy or balloon dilatation. So there is one specific operation for this infantile hypertrophic pyloric stenosis, which is called as Ramstead operation. So it is important to remember that this Ramstead operation is done for IHPS, which is infantile hypertrophic pyloric stenosis. So here we do this laparotomy. Hypertrophic muscle is cut along the whole length until the mucosa bulges out. So that is Ramstead operation. What are we doing here? This hypertrophic muscle is cutted along its whole length, right, until the mucosa is bulging out. So that is the Ramstead operation. So mucosa should not be opened. So we should let it bulge out by cutting it along the whole length. So what is Ramstead pyloromyotomy? It can either be done laparoscopically or open. So if you are doing it open, you have to give incision in the supraumbilical region. So supraumbilical incision is given under general anesthesia. So longitudinal incision is made in the pylorus along its whole length. So hypertrophied muscle is cut along its whole length and will let the mucosa bulge out. Right? We should not cut the mucosa. If the mucosa is injured by mistake, you have to suture it horizontally with the interrupted vicryl. So you can see here in the picture, this is an olive-like mass which is mobile, smooth, and moves with the respiration. And also the child will presenting with the vomiting and constipation and visible gastric peristalsis. And here it is a picture of operation, right? So inner lining bulging through the incision. So what are we doing here? We are giving the incision of this hypertrophic muscle along its whole length and will let the mucosa to bulge out. So that is Ramstead operation. So this is a thick pyloric muscle before the surgery, and this is a pyloric muscle after the surgery, right? So this is a Ramstead operation. To summarize, this is an infantile hypertrophic pyloric stenosis. So what is happening? There will be hypertrophy of the musculature of this pyloric antrum in the infants who are exposed to azithromycin or erythromycin in less than 14 days of birth. So what will you see? You will see vomiting, you will see constipation, and you will see gastric peristalsis, and also an olive-like mass. So this is really specific for this olive-like mass, and that one Ramstead operation is specific for infantile hypertrophic pyloric stenosis. You have to mention it anyway. The diagnosis, you can see and palpate the mass, and visible peristalsis can be seen, and ultrasound donut appearance in the barium mill, you can see obstruction. And the treatment, you have to correct it by the dehydration or electrolyte imbalances. And Ramstead operation, what will you do? You will cut the hypertrophic muscle along its entire length and will let the mucosa to bulge out. If by any chance mucosa is ruptured, you will have to suture it horizontally with the interrupted vicryl suturing. And also, if you want to buy this PDF, you can text me on Telegram. It contains handwritten notes of surgery for university exams. Thank you.